with Dr. Abhay Nene, a spine surgeon and a spine specialist. Thank you, doctor, for your time. I had a question for you. A lot of people land up with neck pain, cervical pain and strain because of the kind of work they do, desk work, like you said, watching your mobile phones and things like that. So what do you recommend? How does one address this?
So I'm glad you're bringing this
Yes.
up because this is a new age disease.
Yes.
You see more and more people with this problem. It's because of the lifestyle we lead.
Yes.
Your neck is a mobile organ, but it has a fixed amount of weight on it, and that's the 10 pounds of your head.
Yes.
However, that fact remains true when you're neutral. The minute you start tilting your head forward, the load on your neck can multiply up to 3x.
Yes.
Most of our works involves putting our head down, which is tilting your head forward, and working on laptops or reading or typing or texting. Now that involves you putting your head at a position or your neck at a position of disadvantage
Yes.
for hours on it. So imagine loading your neck 3 times over for 6 hours at a go. You're going to work out and wear out your neck that much faster.
Yes.
And that's where this whole new generation problem of cervical degeneration,
Yes.
the so-called spondylosis comes
Yes.
up, where your discs start getting overloaded and beaten out of shape.
Yes.
And the capacity of your neck to hold itself up starts to go away. Now the solution to this
Yes.
seems easy.
Yes.
There's a 4-pronged attack.
Yeah.
One is to get your ergonomics right, which means get all your workstations to your eye level, so you're working with your chin parallel to the floor.
Yes.
Number 2 is strengthen the muscles that actually support your neck. So
Right.
the trapezius, the paraspinal neck muscles. There's a very specific, simple, home-based exercise program. Follow that and increase the strength to improve the capacity of your neck to hold yourself up. The third is endurance building. These are endurance muscles. They need to fire 18 hours of the day. And aerobic exercise like brisk walk, cycling, running also
Right.
will help you build up your red fibers.
Right.
And finally, make sure that you get adequate rest, because this muscle switches off and starts to rebuild during your rest time. It's not when you're sitting and chilling, but it's when you park your head on the pillow. So if your sleep is disturbed, you're going to likely come out with your muscle firing poorly, and that's going to be a cascade of events that will lead to cervical
Right.
degeneration.
So do you think sleep posture, the way you sleep and the pillows you use also affects?
Again, that's a very important
Yes.
question. What happens in sleep is you're offloaded. So technically you should be fine, but
Right.
your muscles are no longer protecting you. They're switched off. So
Right.
you end up landing up in a bad posture for many hours at a go. So once again, remaining neutral, which means that if you sleep on your side, you should have a pillow that covers for this entire depth, which means a double or a 1.5 times size pillow, so your head doesn't fall down.
Right.
And if you like to sleep on your back, a thin pillow or a pillow that sticks out under your shoulder, so your head doesn't stick out like this. If you follow these two, you're normally sorted.
That was so useful. I'm sure everybody would really enjoy watching this reel. Thank you so
Thank you.
much. Thank you.